Hi guys, so I just want to make this little video about hip pain during pregnancy. It's something that I've had problems with myself as my pregnancy has progressed, kind of when I went into my third trimester, and it's something that I hear from a lot of women, and something like they've done studies and it's shown that something like 40% of women suffer from pelvic girdle pain, some kind of hip pain during pregnancy. So I just wanted to put some of my thoughts together on this topic, since also a lot of women have told me that they've told their doctor and their doctor hasn't really helped them that much, or the doctor says that it's normal and that it will go away. Personally, when I reported it to my doctor, he said, of course you have hip pain, you're 8 months pregnant, what do you want? Like, that's just what happens. So if you'd like a little bit more information than that and a little bit more guidance than that, then this is the video for you. I think also we get told a lot that, oh, that's just part of being pregnant, or that's just part of being a mum, and that's the story that we're told with lots of things like incontinence and prolapse and diastasis recti, and that's not true. In many cases, in most cases, that's not true. And while your doctor may not be the one to provide you with the information that you need, and the guidance you need, and the professionals that you need in order to be able to solve those problems, there are other people who are able to help you with those issues. It's not always the doctor's job. I know it feels like it should be, but doctors have huge just huge amounts of information, especially gynecologists have huge amounts of information that they need to know and they need to learn. They can't know everything, they can't treat everything, and more often than not, they are just not aware of problems of musculoskeletal complaints like hip pain or back pain and things like that. They're taught, do some exercise, take a pill, go for a walk. They don't know more than that, and that's not their area of expertise. They're there to make sure that there's a healthy mom and a healthy baby, and they do fantastic work doing that. But we need to not rely on them for these other complaints. So first of all, some different types of hip pain that you might experience. Most people are familiar with sciatica, and I've been told when I was during my pregnancy, when I've had hip pain, when I say that to someone, people say, oh yeah, it's sciatica, it's because there's pressure on the nerve and it's like going down your leg. And that's one type of hip pain, but it's not the only type of hip pain. Not all hip pain is sciatica. So yes, there is a condition where your sciatic nerve, which is a big nerve that runs down the back of your leg, gets compressed and can cause pain. It can cause like tingling and numbing down your leg, and it can radiate to other parts, like lower down your leg. That's one thing that you can have, but you can also have SI joint pain, which is where your pelvis is actually two big bones that joins together at the front, and then at the back it doesn't join together. There's another bone in between. There's your sacrum and then your coccyx in between. Go and have a look, Google the pelvis, and there are joints in between your sacrum and the iliac bone, the hip bones. So sacroiliac joint, SI joint. These are really strong, fibrous joints that don't really have much movement in them, and that we can have pain in that area, in that general area. And then where the pelvis joins round at the front, there's also a joint here. It's not just solid bone. There's a cartilage joint here is like similar to the discs in your back in between. These are really, really, really strong joint. This joint is called the pubic symphysis. You might have heard of it. And you can also have pain here, which it can be pubic symphysis dysfunction, or like it's got a whole bunch of names and it can vary, and there's an old name that we don't use so much anymore, but basically you can get pain in that area, and that can be quite a kind of sharp pain, and for some women it can be really debilitating, and for some women it can just be some mild pain there. And then we can get pain anywhere else around the pelvis and with all of the bits that join to the pelvis. So you can get pain. You can get pain in the hip joint itself, where the femur joins to the pelvis, to the acetabulum of the pelvis. You can have lower back pain, which can be confused as hip pain, and hip pain can be confused as lower back pain. You could have adductor pain. You could have pain that's coming from all the muscles, the glute muscles, or lots of different things going on and joining to the pelvis. You also have your pelvic floor there, so pelvic floor pain in that region could be mistaken as hip pain. There's a lot of things going on. In general, women get told, we have a lot of language around laxity, and relaxin gets a lot of blame for being the hormone relaxin. You know, it makes our joints softer, and it makes us it creates laxity in all of the joints, and that creates pain. In actual fact, studies have shown that there isn't a correlation between increased levels of relaxin and pain. And this makes sense because if you think about if 40% of women have hip pain, okay, that's a lot during pregnancy. But what about the other 60%? If relaxin caused hip pain, then everyone would have hip pain. But also women have hip pain. For example, I had hip pain through my 7th month and my 8th month, but I'm in my 9th month now and I have no hip pain whatsoever after treatment. But I must have more relaxin in my body now than I did then. So relaxin and other pregnancy hormones don't necessarily cause hip pain, and we need to be careful about how we use our language when we talk about laxity, or when we talk about instability in the joints, because there's a big psychosomatic element here, that when we don't trust our body, or when we feel that our body's weak or unstable, that this can feed into the loop of pain. Pain is incredibly complex. And so we don't want to use language that feeds into kind of fear of movement and then stops people from moving around and doing and living their lives and doing what they need to do. Also, the pelvis is actually extremely strong, and it takes like a huge trauma, like a car accident, to break bones or to break joints in the pelvis. So our pelvis is not weak, and it's not weak even during pregnancy. So it's not about weakness, and often, in fact, what women find is that what a lot of health professionals find is that the pain is usually linked to tight muscles and not to loose joints or looseness in the joints and laxity in the joints. So you could have tightness coming from your glutes or from your lower back or from your adductors that are causing tightness and pulling and creating and causing pain ultimately. And same with with the pelvic floor. If the pelvic floor is too tight, if the pelvic floor is overactive, this can also feed into hip pain. And this makes sense because most of the techniques and manipulations that physios will use are to actually release tight muscles rather than to strengthen weak ones. And there is a place for strengthening weak muscles as well, but it's quite often the opposite that needs to be done to fix pain. Personally, I had dry needling done in my adductors and in my glutes when I was experiencing hip pain, and it really ease that pain. And there's lots of different techniques, and dry needling doesn't suit everyone. I'm not necessarily an advocate for that specific technique, but it can be really helpful, and there's a whole bunch of tools out there at your disposal and professionals who can help you with those issues. But it's usually about releasing tight muscles rather than strengthening weak ones. Posture and alignment can also play a lot into hip pain, and sometimes the type of activity that we're doing can play a lot into hip pain. So a lot of women will tell me that they're running and jumping and lifting heavy weights during pregnancy, and is it okay for me to do that? And in general, yes, it is, but not if it's causing pain. If you get a pain after 3 kilometers of running in your hip, then this might be something that you need to reconsider. And the types of activities that you're doing, you might need to reconsider how you're doing it, and also how your alignment within those activities. Are you in proper alignment, rib cage stacked above the pelvis, or are you slouching? Have you got a rounded back, and have you got your bum tucked under and things like that? Because these can all feed into those problems. That's pretty much it. That's pretty much what I wanted to say on the topic. Except that you can go and see, there are professionals who can help with these kind of musculoskeletal issues. I really recommend going to see a really good women's health physio or pelvic floor physio. Most countries you can see someone through your healthcare provider, but not everywhere. And in order to see someone really good, it might be a really good idea to go private with someone who you know is excellent. So I hope that was helpful. If you have any further questions on hip pain, write them in the comments below, and I'll try and answer or add them to a future blog post or video. In the meantime, I really hope that gives you some direction and clears up some of your worries or uncertainties about hip pain. Thanks very much for listening.